Now, the following story may disturb sensitive viewers. Earlier this year, 2 suspects smuggled a gun into a public hospital in KZN and fatally shot a patient in the head. Nurses and doctors say these incidents are becoming common. So we undertook an experiment to test the security measures inside some state healthcare facilities. And our findings are troubling. Here's Masake Gan.
Nursing, a calling that attracts people who are dedicated to saving lives. But caregivers at public hospitals and clinics fear that their own lives are on the line. And the threat, the very people they serve, patients.
They're going to be angry because you are taking forever to attend to the emergency.
There are too many incidents with the weapons.
Like you wonder, one day, what if a patient didn't get a weapon?
Violent attacks at health facilities have left staff in panic mode, constantly wondering if the people who walk into their wards have deadly intentions.
32-year-old Neo Kakao works in a ward where mothers make appointments for their babies to be immunized.
When you have missed your day, you happen to be seen the last. People who are booked for the day are going to be seen first. So Umama didn't want to be seen last. Like a hot clap.
There was no security guard in sight.
If it wasn't because of other patients who actually pulled the mom,
Lerato Madumo Kova of the Young Nurses in Daba says nurses are often in the firing line of frustrated patients at under-resourced and short-staffed facilities.
When I'm unable to deliver to your expectation, the community is mostly angry. The altercation that occurs between the patient and the nurse, it's an everyday occurrence.
Patients are also at risk.
People will always say, if you want to finish somebody off, it's easy to do it at a hospital.
On the 11th of January this year, 2 men smuggled a gun into the Clearwood Hospital in KZN and fatally shot a patient in the head. Last year, at the South Rand Hospital near Johannesburg, 3 men assaulted an injured man, demanding a gun he'd carried into the hospital. With no one to protect them, the nurses barricaded themselves behind a locked security gate. In most cases, guards run away because they have no weapons. Guns are prohibited on hospital grounds. Seeing as health facilities are gun-free zones, it comes as no surprise that unarmed guards would run for cover when they come face-to-face with people carrying weapons. In December, at the Levi Mbata Clinic in Everton near Vereniging, a mob forced its way into the facility.
One of the people that were there was stabbed. The rest of the people that he was fighting with wanted to finish him off, and a few nurses had to fight, trying to save this patient.
She says it's easy to get a weapon inside a ward.
Averting and ensuring that the correct people come in and go out, it's sometimes just completely neglected.
There are no official stats to account for violent incidents, intimidation and harassment of doctors and nurses.
But the reports that we get as a union are extremely shocking. A facility that is a CHC, such as Shawela, will definitely have incidences that escalate way above 10 incidents in a day.
On January 13, 2 days after the Clearwood Hospital shooting, Health Minister Dr. Zweli Mkhize wrote that at state healthcare facilities, it will no longer be possible to simply walk in without passing through a security checkpoint. Members of the community should expect that they may be searched. We went undercover to test this and to see if it would actually be possible to enter a health facility armed with this knife, capable of causing serious injuries and even death. 2 days after the minister's statement, we packed a bright kit, including an intimidating knife, and began our experiment, which would take a few days. At the Shawela clinic, there was no guard at the pedestrian entrance, and we simply walked in with the knife. We strolled around the clinic, but couldn't get inside the maternity ward. We pretended we were friends of a nurse who works there.
So since you don't just come and say and then you get to there's incidents.
Next to the metal detector entrance at the Charlotte Maxeke Hospital in Johannesburg is a door without a detector. We enter through the latter and none of the 4 guards queries this or searches the bag containing the knife. The metal detector beeps when we walk into the South Rand hospital with the knife, but no one pays any attention. We carry the blade inside with no hassles. At Soweto's Chris Hani Baragwanath Hospital, a look through the back window of the car and a friendly greeting are all it takes us to get past the main gate with a deadly weapon. At the Helen Joseph Hospital in Joburg during visiting hours, males are scanned with a portable metal detector. Guards take a quick look inside our female operative's bag and don't notice the knife. At all the facilities, the knife would have been discovered had thorough searches been conducted. We were able to get inside most service areas except maternity wards where stringent security measures apply. A 2018 report notes that more than R1 billion was spent on security services at state healthcare facilities in the 2016-2017 financial year, which raises the question as to whether or not there is value for money. Andre Mundell, an independent consultant with over 30 years' experience in the security sector, says poor access control is an open invitation to criminals.
Even if you don't have criminal intention, if the opportunity is always there, you will take a chance. But we don't measure only the incident, we measure the opportunity that creates that incident.
Regular risk assessments help evaluate the efficiency of security layers.
The hospitals never have a risk assessment. So the question I ask them is, what homework or what research was done to establish the type of security they have?
We shared our findings with the Health Department's Arnold Malutana.
No one even really bothered to check our bags. What's your reaction as the department to this?
It's a very scary thought. It's a cause for concern, and I think it's something that we should and we will follow up on it.
He says it's unfortunate that some security companies don't perform according to their contracts.
You'll understand that with about more than 54 companies contracted to the department across all 300 institutions, that the level of performance across all of them will not all be the same.
The department says it takes security breaches seriously and often acts decisively against negligent contractors.
We've terminated contract and said, look, you have failed in your obligation to protect the institution that you have been paid for using public money.
Despite security breaches, there have been some successes.
A baby was snatched from a maternity unit where within hours following the CCTV, producing a picture of who the suspect was, the baby was found.
The security company at Helen Joseph Hospital said their guards are well trained and thorough in executing their functions. This is just an unfortunate situation and it will be rectified. The Bara entrance is on a main road and its contractor says due to traffic, it's not practical and feasible to search every car. The company says it has upskilled the training of the personnel. The security service providers at the South Rand Hospital, Shawela Clinic and Charlotte Matleke did not respond to our queries in time for this broadcast. Sex-fueled incidents are also common. Last year at the Pelanomi Hospital in the Free State, a doctor bit off her attacker's tongue during a rape attempt. Soweto nurse Disetso Morosi says a patient once followed her into a room in the clinic.
And I told him, whatever that you're going to be doing to me, there's a camera there. And then he was like, yeah, uzosinda, uzokubamba ngaphandle.
Nurses say often they take the blame for problems they are not responsible for, such as delayed service because the ward is short-staffed. Disetso was on duty in December when Themba Maseko arrived at the clinic, anxious to get help for his son, who was born in a taxi on the way to the labor ward. The nurse, Disetso's colleague, was delayed.
Because they had another emergency inside the ward. So when she went out, already the escort was aggravated, which is the father of the baby.
Mother and child were transferred to Bara Hospital where they were stabilized and later discharged. But the matter did not end there. Disetso claims Themba began stalking the nurse and one time brought 8 people with him.
I saw Temba again at the parking lot. Later on, when they were knocking on, Temba was waiting at the gate. He said he wants a one-on-one confrontation with her.
The nurse eventually took out a protection order. Temba says his frustration is justified, but denies being a stalker.
Umntwana uhleli lapha ngaphandle nje boma 18 minutes.
Surely you'd understand if maybe the nurse feels intimidated or a little bit threatened.
Based on what has happened, and then now here's a group of men coming to me, then I'll feel intimidated.
Though he understands why the nurse may have been scared, Temba says his group did not have malicious intentions.
The C9 saying we want to know why. And I didn't say, hey leaders, this is the video, this is what they did at Shawela Clinic, let's go and attack. No.
An internal investigation is underway. The unsafe working environment is emotionally draining for nurses.
I feel depressed actually. Like waking up, you question yourself. Do I really need to be here?
If I had a choice, I would say I would stop being a nurse. But nursing is the only thing that I know. I went into nursing when I was 19, and I've been through this profession ever since. So this is the only thing that I know. So, and for what is I mean,